I'm Sierra, and I'll be showing you how to do a glucose check, and I will show you how to mix and draw and administer insulin. So first, that we will check our order for the ActiCheck this morning. I will introduce myself to the client, get the client's name and date of birth against the order to have the client confirm. So I will instruct the client to wash their hands as I would perform hand hygiene. I had grabbed my glucometer, my lancet, and my strips. I would apply the strips into the glucometer, and I would ensure, and I would wipe the distal lateral finger with alcohol swab well, and then I would prick with the lancet. The first drop of blood I will wipe away with the alcohol swab, and then I would ensure I have the second drop, and I would drop it onto the glucometer strip and hold pressure to the site, ensure there's no extra bleeding. I would then get the documented results. I'll explain the results to the client. If it's low, if it's high, the range is 60 to 100. So then after that, I would ensure that I have discarded things into the proper area. I would disinfect the glucometer and wash my hands. I will go document. And then now I'll show you how to mix and administer the insulin. So first I would check my doctor's order, grab all my supplies, my insulins, my needle, my alcohol swabs, and my gloves. So then I would enter the client's room, introduce myself to the client, assess the client for the name, date of birth, any allergies. I would check for hypo or hyperglycemia. With hyperglycemia, we can see the 3 Ps: polyuria, polydipsia, polyphagia. And with hypoglycemia, we can see shakiness, confusion, just really tired, dizzy. That we would see some shakiness, tremors, tachycardia. So ensure there's nothing of the sort going on. I would have my results from earlier today with the glucometer, and then I would ensure that the client is ready to eat at this time, and I would assess the client for the last site of the injection. I would tell the client that we have a few sites. We have the 2 inches from the umbilicus on the abdomen, or the back upper parts of the arm. Okay, so we're gonna start drawing up. I would wash my hands, ensure I have 5 units of MPH and 5 units of regular. I wash my hands and don gloves. I have my insulin syringe. Again, this is my second check of my order. 5 units of MPH, 5 units of regular. We inject air into cloudy, which is MPH, first without touching the medication. First, I am cleaning off of my vials. So 5 units of air for the MPH. First, we have rolled these. We have rolled these to mix, and that is a great point of education for your client. Don't ever shake. We roll gently. So 5 units of air into the MPH without touching it. And then 5 units into regular. With regular, we will draw regular first. and then back into cloudy, which is NPH. Ensure another 5 units, which would equal the total of 10 units of insulin. If I was outside of the room, I would label this. I will be scooping using the scoop method, using 1 syringe. So like I have stated to the client, we have multiple sites, 2 inches away from the umbilicus or the back of the upper arm. So with this client, it depends on what angle, how much of the fattiness of the skin you can pull up. If you pull up 1 inch, we'll go at a 45-degree angle. If you pull up 2 inches, we'll go at a 90. It depends on the client. So right here, I say we'll pull up 2 inches. I will clean the site for 30 seconds. And with insulin, before you administer, ensure that you have 2 registered nurse checks to ensure safety. So I'm gonna take this off. So since we're pulling up 2 inches, we'll go at a 90-degree angle. Inject slowly. And then discard. Apply pressure if need be. And then gather your supplies and everything. Discard your gloves. Check for client for any adverse effects, any redness, swelling, bruising, irritation to the site. Wash your hands. Ensure client is in a low position. Give the call light and go document. As I previously stated before any administration of medication, I did it in my intramuscular video. We'll do the 6 right medication administration: right patient, right route, right dose, right medication, right patient, right medication, right dose, right route, right time, and right documentation. So once I leave the room after performing my hand hygiene, I will go document those 6 rights. I will document the time, route, dose, medication, and how the patient has tolerated it. Thank you.